Good afternoon, everyone. I wanted to send a sincere welcome to all of you. We're so glad that you are joining us today for this community update. I really want to extend a deep appreciation, actually from the bottom of our hearts, to all of you for all that you do for our community. You give us hope. As the saying goes, we are in this together, and we are in this with you for the long term. And that's a little bit about what you're going to be hearing about today. I also wanted to mention that we're entering the giving season, and I encourage you to please continue to support our local community. We recognize you have many choices. Your gifts to our local nonprofits and our COVID fund really make a huge difference. And again, I thank you for all that you've done and all that you will continue to do. On the screen here is a couple comments that some of our donors made recently, so we just wanted to share them with you. All right, now we're going to get on to some housekeeping, and then I'll turn the program over to Christina. I just want to explain the format for today. Christina will speak for about 25 minutes. I encourage you, as questions emerge, to put them into the Q&A section on your screen, and we will be monitoring them. And when she finishes, we'll have some time for some questions. And then the program will be turned over to Will, and he will give you a little preview of some of the work that we've been doing and that we plan to do as we step forward in 2020 and begin 2021. All right, I will now turn the program over to Christina.
Thank you, Dottie, and good afternoon, everyone. I'm just going to share my screen. Okay. Okay, so I also want to welcome you and start by thanking you all, as Dottie did. Thank you all for your generosity. Because of you, together with the United Way, we distributed over $2.7 million in grants to 130 organizations over a 3-month period through our joint COVID-19 community fund. And many of those resources were donated by many of you on the phone, on the call. It's not a surprise that most of those resources went to basic needs and health organizations who were on the front line in the very early days of the pandemic. And towards the end, some of our final rounds of grant making from the COVID fund were towards education organizations and starting to address some of the issues around access to education and learning. So after we finished our final round of COVID fund grant making and the other steps the Community Foundation took to address the pandemic, which included accelerating many of our grant payments, accelerating our grant process by a few months, and accelerating our grant progress by a few months, and also launching the Great Give, which raised over $3.5 million, close to $3.6 million to support nonprofits who were impacted by the pandemic. So I think the moral of the story is that the generosity of this community has really been overwhelming and has gone a long way. And we're going to share the results of some of that today and talk about the ongoing needs. So after we made our final round of COVID fund grants in partnership with the United Way and our COVID fund committee, we took a pause to do some listening and learning. We looked at the impact of our COVID-19 grants. We supported a report that Data Haven did to collect more data and information around community well-being, and we'll share some of that today. And we talked to a lot of folks through some of our existing programs and grant support who are working directly with people being impacted and who are people being impacted by the pandemic. We also did a lot of research in the sector. There's a lot of emerging research on the pandemic, its impact, and all of the racial inequity and the injustice issues. So, and today, as we continue listening, we're going to share that information with you. I'm just having trouble forwarding my slide. Okay, so the report is divided into two sections. We're going to talk about the state of the nonprofit sector, and then we're going to talk about the state of community well-being. So the state of the nonprofit sector. While national and statewide predictions tell us that anywhere between 30 to 50%, which is a pretty widespread, of nonprofits will close because of the pandemic, local experts here in Greater New Haven, nonprofit leaders and consultants working directly with organizations to address the pandemic have a much more optimistic view. I mean, the view is dismal and catastrophic for some, but we don't think that it's going to reach, we don't think we're going to see 50% of nonprofit organizations close as a result of this. At least we hope not, especially seeing how this community has come together to rally and support the sector. According to a survey that we supported back in July, a survey of nonprofits, we saw that organizations with operating budgets under $1 million have been hardest hit. They're more than twice as likely to have a severe or total reduction in revenue, and more than 4 times as likely to experience losses in excess of 30% of their operating budget. More than 60% of organizations report moderately reduced or severely reduced capacity to deliver their normal services during the pandemic. And 40% report that once individual benefits taper off, which happened at the end of July, they anticipate an increased demand for their services. And I think we're already seeing that happen. I think I saw in the New York Times recently that since July, millions of people have fallen into poverty since some of the benefits have ended in July. While over 70% of organizations had reported at the time that they will likely be able to fully fund staff salary and benefits, at least for the next 3 months, which we think has been impacted by the accessing the PPP loans. 25% say that it's unlikely they will be able to continue to fully fund staff over the next 3 months. And we're at the end of that 3-month period, that 3-month projection. Also, according to this survey, most organizations reported that it's likely they will be able to continue to fully provide services over the next 3 months, but nearly 30% reported that it was unlikely. This was a pleasant surprise. Nearly 75% reported that they had adequate access to PPE for staff and clients. A lot of our grants during the COVID fund grant making went to support PPE for organizations, for their staff and clients. And we were glad to see that a significant proportion of organizations felt they had adequate access. Also, more than half at the time reported that they felt they had adequate access to testing for staff and clients. So I thought that was good news too. But that was now 3 months ago, and I'm not sure how that has changed. Of course, organizations are suffering from major financial issues and lost revenue. The top 5 issues they report is lost revenue due to cancellation of fundraising events, although now some are regrouping and getting innovative with their fundraising events and virtual events. Loss of fee-for-service from canceled programs and events. Loss fee-for-service revenue from reduced utilization of services. In the early days of the pandemic, people were not engaging in services at all. And for organizations who provide modest fees for some of those services, they were really impacted. And incurring of additional COVID-related costs around PPE, cleaning, and retrofitting their spaces to accommodate the new rules that everyone needs to follow around social distancing. And organizations are also reporting a decline in donations from individual donors. We also see from our grant reports and our capacity building work and other interactions we've had with nonprofit leaders that nonprofits they've really been incredibly adaptive in terms of responding to the needs of their constituents and pivoting to alternative ways of doing business. We saw this especially out of the gate with the homeless providers, the basic needs providers, and the healthcare providers who were all on the front line and really had no choice but to pivot. And we think that adaptability was really important. We see that our support, the foundation support that was used to purchase cleaning and safety supplies and PPE, and also support to provide technology capacity, was really the most impactful thing we could have done for organizations at the time. We also saw that our support to put cash in the hands of individuals was an approach essential to meeting basic needs of individuals. A lot of the grants we made through the COVID fund, we made knowing that the money was going to be redistributed in the form of cash or gift cards to people in need and people suffering. And in the normal course of business, those are not grants that the foundation is typically comfortable making, but we also had to adapt our thinking, and we made those grants with great success, I think. Funding uncertainty is looming large for nonprofits, especially large nonprofits who rely on state contracts, grant revenue, fees, and have a lot of staffing costs. We are worried about arts organizations. They are facing a unique set of challenges, and I think it's important for us to mention and acknowledge that. The foundation is one of the only institutional funder of arts in the region, and many of the donors we work with care deeply about arts and culture organizations. We have seen an increased demand and request from organizations who want to access diversity, equity, and inclusion and anti-racism trainings for themselves and their constituents. And the foundation's, some of our conclusions here is that the foundation's grant support needs to be as flexible as possible. One of the things that I've always been proud of is that we are really ahead of our peers in our willingness to provide flexible general operating support grants. In any given year, 50 to 60% of our competitive grant making is for general operating support. And we are somewhat unique in that. And I think we will see that begin to shift even more as time goes on for us and for philanthropy in general. We also feel that the foundation should focus more on sustaining programs and essential services and not on saving organizations. I think this is going to be an enduring tension that we have to, that we're going to continue to face as the pandemic looms on. We also are thinking differently, and we must think differently about our multi-year grant support. We give out a lot of multi-year grants. It provides stability for organizations, knowing that they have a 2 or 3 year commitment from the foundation, and in some cases, 5-year commitment. But we have to think about stability versus the time of change we're in. While those grants offer stability, there is also going to be a lot of change and uncertainty for those organizations moving forward and for all of us moving forward. And we're thinking more carefully about how we balance that in those decisions. And we have to consider new and innovative ways to incorporate voices of lived experience in decision-making, solution, and program design. We must also work more deliberately to dismantle racism to achieve equity and mobility by deploying all of the philanthropic tools we have. I keep repeating this. Some of you have probably already heard me say this if you've talked to me this week, and I heard someone else say it, is that we cannot grant make our way out of this. We need to bring to bear all of the tools that we have and figure out which tools we can be most impactful in deploying. We need to think about amplifying people power and supporting community organizing efforts, including both organizations and individual change makers who are actively working to dismantle racist structures. We hope to provide professional development support for BIPOC-led and BIPOC-serving organizations. We want to increase access and diversify sector leadership. We want to figure out what our role is on advocacy and where we can lead on advocacy. And we need to think about the role for arts and culture organizations and their role in raising awareness through performance, culture, and exhibits around these important issues. And we need to examine our own internal processes and policies, especially as it pertains to grant making. At the end of the presentation, Will is going to talk more about our plans and how we're thinking about some of this stuff moving forward. So in addition to reaching out to nonprofits and collecting information from nonprofits, we also gathered information from and listened to voices of lived experience and residents who are directly impacted by these issues. And one of the things we did is we were one of the lead funders for Data Haven's recent report titled The Role of Social Inequity and the Impact of COVID-19. I have pulled out a couple of slides here with data from this report, but I urge you all to look at the full report. It is really filled with fantastic information. I think it's some of Data Haven's best work, and I've been trying to do a lot of research, and I haven't seen anything out there like this. So Mark, I think you're on the call, and I'll say publicly, job well done. And maybe later, if people have questions about the data, we can unmute you and you can answer some of that. But like I said, this is just the tip of the iceberg in terms of the data. So one of the things that the Data Haven report found was that 1 in 5 Black adults has lost a loved one to COVID-19. And you can see here, you can see the disparities here among people of color, Latinos also, in how they have known people who've tested positive, have been hospitalized, and have died. We also see in that report that Black adults show great concern about exposing family to the virus, and this is among people who are leaving home to go to work. And you can see this huge 61% of Black folks were very concerned about the risk they were posing to other people in their family and their friends. This was a little ray of hope, at least for me, while I think it's evident across the board that people's level of trust in the ability of the federal government to keep them safe was not great, and it seemed to be unanimous across all of these areas, whether it was the suburban or urban core population. That data is very similar. But when you look at people's trust in health officials to keep them safe, that was pretty high, and it was high across the board, whether people lived in the urban core or urban periphery or in suburban or rural communities. And I think that that's really positive, and it's actually probably one of the reasons why Connecticut was doing such a good job in managing the pandemic in recent months, although I know we see now that we're starting to see a spike in cases. Also, another positive thing here was people's trust in police and state government too, which, given what's happening in the world and across this country, I thought that these numbers also provided a ray of hope, and is certainly linked back with what I feel like is how this community has rallied during a very difficult time. We see, in general, we see that people of color and women are hit hardest by the economic impacts of COVID-19. And you could see some of the disparities here. Among the Latino population, 37% have lost a job or been laid off, and close to 40%, the same 36% have had a reduced work or furlough. And you could see those numbers are high too among lower income workers as well. We see higher income and female workers are more likely to be working from home. As I said in the previous slide, that we know people of color and women have been hit hard in terms of the economic impact of the pandemic. And you could see here, 41% of women report not leaving home at all to go to work, 40% are working home, and there's a lot of burdens that come along with that around childcare and homeschooling. I've had a small taste of that burden myself. And you could also see higher income individuals too are more likely to be working from home, which offers more flexibility for some and also more protection from the virus. We also did a survey of lived experience through some of the programs the foundation supports and houses. We talked to participants in our New Haven Healthy Start program and in our neighborhood leadership program. We also talked directly to some immigrants and formerly incarcerated individuals through the organizations we're working closely with around those strategies. And what we heard from those groups is that mutual aid groups have been a critical resource of support for individuals in the community. And we supported many of those groups for the first time through our COVID fund Grantmaking. And they were really an important piece of the puzzle in terms of responding to the pandemic. We see that undocumented immigrants feel abandoned by the state and city government. We know that undocumented immigrants have reported that they've had to acquire their own PPE in order to return to work. And I think that this is a broader issue among people of color. And I believe some of that, there's actually some hard data on that in the Data Haven report. Top concerns these folks reported were around food, medical, childcare, legal aid, and mental health. And the top 3 resources people reported using for information on COVID-19 was local television, their doctor, or friends and family. And I thought this was really interesting. We don't see social media or the internet here in this top 3 ranking. And I think we could learn something from this, especially as we think about raising awareness and getting the word out around the pandemic and other issues. The top 3 areas that people reported that were most impacted areas of their lives were around employment, childcare, and mental health. The top 3 specific impacts of COVID-19 that people were experiencing was losing a job or knowing a friend or family member infected with COVID-19, and certainly increased feelings of isolation. Most reported knowing where and how to get assistance and minimal trouble in accessing services, with some exceptions, of course. So this final slide that I want to end with is just some of my own reflections as I was looking at all of this information and trying to synthesize it into a report. And I want to share some of that with you. I think these are some of my own personal reflections, but also reflections for the foundation and for philanthropy in general. The first is around flexibility and being nimble. I think we all need to think about how we can be more flexible and nimble in our philanthropy, especially now, removing as many barriers as possible to accessing support. We need to be courageous and take more risks. I was talking to one of our board members earlier this week, and she was saying, you know, we shouldn't be afraid to fail, but we need to fail fast and pivot. And I thought that was good advice. She said, we can't take time to fail slowly. We need to think about sharing power more. In philanthropy over the last several years, there's been a lot of talk about participatory grant making and how we share power and decision making, and put resources in the hands of individuals who are impacted by issues and having them make decisions about how the resources are deployed. And I think now more than ever, we need to think more about how we can do that. We also need to continue and strengthen our authentic engagement and inclusion of all voices in our work. We need to be innovative and creative. A lot of times in a crisis, that's where a lot of innovation emerges, and we need to be willing to support some of that innovation. We need to accept that this is a dynamic situation and our response needs to be iterative. We're always going to, I think, be changing how we do things. And I've been thinking a lot about generosity, and not in the form of financial resources or charitable giving, but generosity of spirit, and how we need to have patience with each other and understanding and empathy, whether it's at work, at home, at school, in the grocery store, wherever you may be traveling. I think these are difficult times for everyone. And I think we need to think about how we exercise more generosity in a deliberate way. I think what gives me hope is that the greater New Haven community seems to be doing something right in its response to COVID-19. While the racial and ethnic disparities are dismal, and this pandemic has certainly, I think, exacerbated those disparities and has made them, and has also shined a light on disparities that were always there. I think we seem to be doing something right based on we're learning. People seem to have a level of trust in each other and local officials, and they seem to have an experience of being able to access assistance and information. And despite the current circumstances, many people report positive feelings of optimism. And those are some of the things that I'm thinking about and holding on to as I think about our work moving forward and trying to be optimistic about the path forward, given the challenges we have before us. With that, I think I will stop and end. I think I have to stop sharing my screen.
So thanks, Christina. I encourage people to put their questions in the Q&A box, but we have a couple that have come up. So the first one, Christina, is this question is not intended to pit one nonprofit sector against the other, but one of your conclusions is that the foundation will focus on essential services and programs, not on saving organizations. Yet on the very next slide, the need to define a role for arts and culture organizations is prominent. Could you elaborate on that?
Sure, and we certainly don't mean to pit one type of organization against another, and the need is across all organizations. And although there's been a significant amount of generosity and philanthropy, no one issue has been solved. There are still gaping holes in the safety net, and there are still many organizations and individuals suffering as a result. I would say, in terms of my comments around this tension, which we anticipate between how do we support the essential services that individuals need. And by essential, I'm not necessarily leaving anything out. It's health, it's basic needs, it's housing, it's all the things we already do. And we think arts is an important part of the fabric of the community, not just as a way to raise awareness about the issues we're all facing now, but it has a lot to do with community cohesion and how people feel part of community. We also have resources dedicated to the arts. So we are in a position to continue to support arts organizations through this pandemic. So while we have to find a balance and make difficult decisions, we do have specific resources dedicated to specific areas that we need to think about how to deploy. And one of those areas is the arts.
Thanks, Christina. So you just actually, in your answering that question, mentioned housing. There was an individual that said that they were surprised that housing wasn't more integrated into the presentation. Could you talk a little bit about housing?
Sure. I would say if you asked me today, what are the issues front and center that we are most concerned about in this moment as a result of the pandemic? As I just said previously, there are gaping holes everywhere. But I think housing and the looming eviction crisis that is going to result from the moratorium on moratorium on rent ending, a moratorium on evictions, which I think is ending in December, is very concerning. We're concerned about legal services and our ability to, and the legal aid services ability to manage all of that. And if individuals become homeless, the homeless shelters are operating differently now, and there's not enough room in the homeless shelters to accommodate all this. So housing is a front and center big concern for us right now, as is education. I would say early in the pandemic, our resources were going to on the ground basic needs, food and shelter, as well as health services. And, you know, shelter is part of housing, and I think the homeless shelters did a great job adapting, and they had to move everyone out to hotels. So that was some of our early housing support. Moving forward, it's going to be around housing stability and the impact of the eviction crisis.
Thanks, Christina. Mark is alive now. If Mark Abraham, if
Oh,
there's
good.
a specific question that you have or that Mark wants to add to the presentation, we're able to do that now.
I would just ask Dottie, if I could, I would ask Mark, I certainly couldn't do his report justice with a few slides, but Mark, I'm wondering if there's anything you think would be important to add to the conversation in addition to what I said.
I think you did a great job covering the topics, and certainly there's, I think, mental health needs. I know that came up with the qualitative or focus groups you did, but we can definitely see in the survey, especially people who've been laid off, or just in general, I think there's higher rates of sort of depression that are evident in the survey and also seen nationally. So it's hard to say what impact that will have, but definitely on people's minds as, the stress of the pandemic sort of wears on families and people who've been adversely affected economically. But you did a good job highlighting like the takeaway around, the extent to which some parts of the community can stay home and feel safe at work and that sort of thing versus segments of the community that are having to go to work every single day and feel like their employers are maybe, they're more concerns about the virus and how it will impact their family.
Thanks, Mark, and great job again with the report.
So we were talking about the arts fund that we have at the Community Foundation, and I just want to, for our donors that support the arts, the governor just announced a arts challenge for arts organizations and a match that's very time sensitive. So I'm sure you'll be hearing more about that from our local arts organizations. So there's another couple more questions. I think we have about 5 more minutes for this section. Will these statistics be gathered and reported regularly so we can see trend lines?
That's a great question for Mark. Data Haven is going to be launching their community well-being survey on its regular schedule. This report was done to advance some of that work. But Mark, are you going to be collecting these same indicators moving forward?
Yeah, so typically we do a survey throughout 2021. So at points, the idea would be at points during 2021, like, in the spring, summer, fall, we could release the same data and see what's changing. If funders wanted to support it earlier, we could do that, like, in December, January as well. But this type of survey is very costly. So I don't anticipate that happening, right after the election, but it is possible.
Thank you. Another question. A huge limitation for nonprofits was help with attaining PPP loans, which was crucial to making it through the early months of this pandemic. Could capacity building in this regard, or at least guidance on navigating the governmental assistance landscape, be possible for the foundation?
I think yes, for sure. And I got a question someone sent in before the presentation about advice for nonprofits that we might have in helping them project what's going to happen and manage what's going to happen. And so to answer that question, yes, we can do that through our capacity building and technical assistance program. And we do have programs right now and workshops going on and available to help organizations plan and adapt and respond to the pandemic. And you could look at our website for those offerings, and there'll be more coming.
Thanks, Christina. Another question. I am interested in hearing a bit more about your plans for authentic engagement and inclusion and your interest in amplifying people power. How will you deal with the potential of community voice asking that you move from current plans, practices, and strategies in what they actually want to see happen?
So I feel like that's a lot of questions wrapped up into one.
Right.
But we are actively talking about that. We're actively considering some grant making that will transfer assets to other groups to make decisions around that. And we are going to continue with our outreach plan, as we did to generate this information, to reach out to folks to find out what the significant needs are. And I think this idea of participatory grant making and authentically engaging people more is significant part of our plan moving forward, which we are currently working on, and which Will is going to talk a little bit about in a few minutes.
Great, thanks, Christina. And one more, and then we'll turn it over to Will. So one of the issues I haven't heard addressed is the unfortunate possibility of great educational gaps and challenges. Has the foundation, looking forward, have any plans to address how the issues of losses of the very population that has been compromised by virtual education and et cetera, and what support educational efforts should be focused on going forward?
Yeah, I mean, there's short-term and long-term. That's a short-term and long-term question. As I said earlier, if you asked me today in this moment, I think housing and education are the two of the things we are most worried about, and figuring out how to tackle, not just for ourselves, but in a more coordinated philanthropic response. Right now, there are learning hubs are being set up in New Haven. That is certainly a good strategy to support remote learners in the short term, but we have to think of ways of addressing certainly the long-term impact of this on the disparities we see in education. And if people have ideas and suggestions, we would certainly love to hear those, but we are actively engaged in those conversations and thinking about that.
Wonderful. Thanks so much, Christina. There's a lot that has to be digested in this information, and
Yeah.
more to come. So thanks so much. Now we'll turn it over to Will.
Great. Well, thank you, Christina. Thank you all. And I want to extend my welcome as well to everyone on this call. So many friends and supporters and partners of the foundation for such a long time. One of the painful impacts of COVID is that I only see you all now as faces on a screen or names on a list. But I want you to know that we feel that connection still. And we miss the opportunity to be with you and to learn from you. So thank you all for joining us. I'm going to talk really picking up from what Christina has laid out, describe how the foundation is planning to move forward, not only in the immediate term, but over the next several, meaning 3 years. And what I'm about to describe is still very much coming together. It's still very much in the planning phase. So this is in the nature of a sneak preview for you all, and would be, of course, eager to get your reactions, not only here this afternoon, but going forward. Before I get into this, I would just say, and to some degree this repeats what Christina said, but so we started our response to COVID in the spring, very quickly turned to grant making, and raised and spent almost $3 million working with United Way of Greater New Haven and many, many nonprofits. And as Christina has just described in detail, we really devoted the summer months. Once that was done in June, the grant making was done in June, we devoted the summer months to learning and assessing what was going on in the community. This is something that everybody probably knows, but so the data you just saw is mostly from July and August. And of course, in the last 60 days, this situation has continued to evolve. The federal money that made such a difference earlier this year, the multi-trillion dollar federal actions have largely run out. And there hasn't been new legislation. That's all bottled up right now, I think, waiting till the dynamics change after the election. That's making a big difference and a big negative difference. And secondly, of course, COVID is coming back. It's not coming back. It's not spiking hugely in our region, thankfully. That's happening in other parts of the country, but the numbers are ticking up. So far from feeling as though we are coming out the other end of this, that is not the way the foundation is thinking about it. And that's not what the data tells us. So, stepping back from the nonprofit sector and the well-being surveys, the work you've just seen, here we are in October. We're 7.5 months into the impact of this pandemic. Even with a recovery, tens of thousands of people in our region have lost their jobs. COVID has exposed the shortcomings and the inequities of our basic systems, healthcare and education, and has exposed as well the underlying racial dynamics behind the disparate impact we're seeing around healthcare and education and in so many other ways. Disparate racial impacts, and as Christina said, disparate gender impacts as well. COVID has deeply impacted and is threatening, deeply impacted the small business sector and is threatening many small businesses. It has undermined the finances of the major public and private institutions in our community. COVID has devastated the safety net, both public and private. And as you just heard in detail, it is posing an existential threat to so many of the critical nonprofit organizations and services that they provide to the people in our community. So that's a pretty grim picture. And lest any of us ever feel that, 7 months in, that we're getting used to the situation we're facing and this is our new normal. We can't afford to think that way. It needs to be addressed. And so the foundation fundamentally is of the view that these are extraordinary times, and for the community foundation, we need to treat them that way, and we need to take extraordinary measures, and we need to step forward. And that's why we're calling this initiative Stepping Forward. It is both to address the social and economic impact of COVID that I just described, and it's also to address ourselves to the dynamics around racial equity. Certainly COVID has underscored and highlighted the racially disparate impacts of COVID, have underscored and highlighted how the basic systems in our society produce racially disparate outcomes and have racist origins. So we're talking about how and where people live and how housing is and the housing systems in our society. And we're talking about how and where people get healthcare and the healthcare systems in our society and the educational issues that one of our questions just raised, and on and on and on. So as we think about the foundation's response, we are thinking both about addressing the impacts of COVID and addressing racial equity. And in some ways, and I think this is an important point, we think of the racial equity issues I think there's an opportunity around racial equity too, because because of all that's happened, this is fundamentally a time of change. On issues of race and racial equity, there's new energy, and this is true in New Haven, and it's true in Greater New Haven, but it's also true across the country. New ideas, new energy, new leaders, new dynamics. This is a time where the potential for positive change around race and race relations in this country feels very real. And it's a time of change much more broadly. So we are approaching these issues, we're approaching this time as a time when change in our basic systems is possible and change in our basic racial relations is possible. And that's the way we're proceeding. And that's why we feel that not only to meet needs, but to take advantage of this time of change and seize the opportunities it presents. This is a moment for a major increase in discretionary spending by the foundation for the benefit of this community. So we are talking about both for current use and for endowment. And this is all supplemental, what I'm about to describe is all supplemental to our regular endowment draw each year that funds our programmatic activities and funds our administrative costs and other and everything we do. This is all supplemental. So we're talking over the next 3 years, again, 21 to 23, we're talking about somewhere in the range of $14 to $17 million in supplemental discretionary funds that would be funded from our endowment. So this 92-year-old foundation has never gone deep into our endowments and done and pulled resources out in the way we're describing, the way we're planning. We would actually structure this as a line of credit, borrow against it to raise the capital in the front end, and then pay it back over a period of years through a supplemental spending rate. We're modeling a 5-year payback, which would raise our spending rate from 5.5%, which is where we are today, to about 6.8%. So this is only against our unrestricted and preference funds, of course. This is only against the funds at which the donors have granted the foundation discretion. And we are going to be adhering to the basic categories in which, for our preference funds, which our donors have stipulated. So we're doing this, of course, with donor intent in mind. And we will be, in addition to that, that's about $12 million that we're going to be taking out of our endowments, roughly in the $11 to $12 million range. We're also going to be doing current use fundraising for a total of somewhere in the range of $14 to $17 million. And we're also going to be starting new endowments and raising money for those, both from our own resources and from and donor resources that are available to us for these purposes, and also from new money that we will raise. And we're starting 2 new endowments, one for basic needs, which we started this year in response to COVID, and the other for racial equity. So, so that $8 million includes, as I said, resources that are already at the foundation, and it includes new monies as well that we will be raising over the next several years. So all in all, you know, this represents over $20 million in new discretionary resources for the foundation, most of which, not all of which, would be available for current use spending. The program plan under Christina's leadership is coming together now, and we're working very closely with our board on this. Obviously, support for the nonprofit sector and the preservation of needed services, as you just heard, is a critical priority in light of COVID. Our framework, we're talking about what are the social determinants of equity. And in this time of change, when these basic systems are being questioned, how can we help promote change to produce better services, to meet the needs of the community, and to tackle the inequities that exist within these basic services. So that's the framework we're thinking about. We're talking about new processes as well, recognizing that the foundation's traditional ways of making our decisions, which are designed to promote broad, equitable access, et cetera, et cetera. We're obviously not abandoning that principle, but we also need to be able to respond more quickly. And we need to be able to respond to individuals and organizations that may not have the kind of track record and organization that we have typically looked for when we make large multi-year grants. And that relates to the last point, which Christina mentioned and which there was a question about, which is this idea of ceding power and control over resources. And this loops back to, in my judgment, to this idea that this is a time of change and there are change makers, and the family supporting them, wants to support the people and institutions. You know, some of these are individuals, some of these are organizations, some of these are groups of individuals that have come together but are not necessarily in the form of a 501c3, and some of these, of course, are nonprofit organizations as well. But to be more flexible, be more nimble, and be more willing to put resources in the hands of those who are pushing for change in our social systems, change in our race relations, and to see what comes from that. So we will have resources to do that under this plan. And as I said before, because these monies are supplemental, we will also continue to have resources to do our grant making in the traditional ways as well. We are well down the road on this in terms of working with our board of directors. The board worked on this over the summer. So we are looking forward to putting those detailed pieces in place and to making an announcement about this in mid-November. So that's where we are, and I would be happy to, if we have time, we have a few minutes to add anything that people would be interested in hearing more about. And again, I thank you all.
So if you have any questions at this point, please put them in the Q&A box, please. So here's a question, will donors be able to participate in participatory philanthropy seeding power programs?
I'm sorry, Dottie, will donors, was that the question?
Yes, be able to participate in this new form of seeding power.
Yes. The short answer is yes. How exactly that will take shape remains to be seen. We were meeting as recently as yesterday afternoon with our donor group on basic needs and talking about exactly that, in fact. And basic needs is one of the core things that we have been and need to be responding to related to COVID. So clearly the answer is yes, and that'll probably take different forms in different ways, but we're eager to engage our donors not only in terms of resources, but in terms of participation in the participatory philanthropy. Yes.
Thanks, Will. Okay, another question. To what extent will the additional spending tackle root causes and make systemic changes versus providing basic needs?
Very much so. Basic needs is a key issue, and it's one, as I said, there's a basic needs fund we're starting, which is an endowed. We have started, which is an endowed fund, but this is much more about the social systems and structures that have been to a significant degree undone, or at least have shown their weaknesses and their inequities in light of COVID, and what kind of changes are needed, and what kind of changes philanthropy can help to create by supporting change makers. So this is very much about root causes and systemic change. And within that, of course, we'll be supporting the provision of specific services, because as you've heard, and as everyone knows, and as you've heard in detail in this presentation, those needs are enormous as well.
Thank you. Do you want to add anything to that, Christina?
Yeah, I would just say, to add to Will's comments, we need partners in this work too, because we certainly can't do this ourselves, and it's not something philanthropy can do in isolation. So partnerships and collaborations is an important part of our plan moving forward.
Great. There was a comment, will the slide deck be available? A couple people came in late. I can tell you that we recorded this session, and we will be sending out an email after the program, and the recording will be part of that. Another question, what are your current plans for bringing the donor community along with you as you learn more about racial equity and justice?
I think specific plans have not yet taken shape. I mentioned that we are establishing a new racial equity endowment fund. That's in the plan, and obviously we'll be working with donors on that, not only in terms of contributing to the fund, but in shaping what that fund looks like. Exactly how that's going to play out is yet to be seen. But you know, I think, and maybe I'll answer that question broadly as follows. The basic idea of stepping forward is that the foundation is stepping forward. And part of what we hope will happen from this is that others step forward too. As donors, as concerned and engaged citizens, as major institutions in our community. Our community right now, for all the reasons you've heard and all the reasons you know, needs all of us in a way that perhaps is unique in our experience. So, you know, our plans are, in the broadest sense, to engage as many as we can in this effort, not just through what we do, but to mobilize and inspire others to step forward in their own ways. So that's the basic principle. Exactly what that will look like hasn't been fully put in place yet, but that's the basic principle.
And I'd add to that any ideas that people have, we welcome them. Christina, did I see your hand go up, or was that?
Yes, I wanted to add that I think there is, I mean, the question was about how to engage donors in the learning journey. And I think we're all on that journey, and we will be providing opportunities for us all to learn together. There's been some recent opportunities, but I think there will be, people can expect to hear about more moving forward.
Thank you.
To be specific, we just had, we've engaged a group called the Racial Equity Institute, which is based in North Carolina. Their first presentation for us, which included staff and others, was last week. It's a fascinating and very challenging presentation about all the major social systems in our society and how they produce racially disparate impacts, and how even if you control for things like socioeconomic status and other factors, the impacts still come out, the racial disparities still come out very strongly. It is a social system look at race and racial disparities in our country. There's another event, another presentation. They're doing the same presentation a second time on the 13th of November. And we can open that up to people who are interested in being part of that. So that's an example of how we want to bring others, donors and others, into what Christina aptly called our learning about racial equity and justice and changing our perspectives.
I'm glad you brought that up, Will. So we'll make sure people on this call receive an invitation to that.
That would be great.
All right, any closing remarks? Will or Christina?
You know, go ahead,
I
Christina.
was going to say, I posted a note in the chat that I'm happy to talk with people offline. If you have ideas, feedback, or other things that you're thinking about, we welcome your input and feedback, and actually required it of ourselves to listen to you as we develop these plans moving forward.
There's another question, Dottie, in the Q&A.
All right. All right, so one last question. It's 12:57. The climate crisis is one of the foundations of social inequity, although it's slightly slower moving one. How are we responding to the climate crisis?
I agree with that observation, that it is one of the foundations of social inequity. And while it is slightly slower moving, it's accelerating, as we all know, in ways that are terrifying. This has not been a major focus for the foundation historically. For whatever reason, we have environmental funds and we're engaged in these activities, but this has been less of a focus in terms of the resources that have contributed to the foundation over time, less of a focus in terms of the growth of the community foundation over many years. I think that should change and needs to change. And perhaps this moment, given where we are on climate, and given hopefully our government is going to change its view on those issues, this might be a moment to do that. So I'm glad the question was raised. I would also just point out on this from a totally different perspective. I saw an announcement this morning from Yale University that President Salovey has appointed a committee to look at the issue of Yale's investments in fossil fuel companies and to incorporate the values of the Yale community in revisiting those things. So that's another perspective that we might at some point take up the issue of climate change from that perspective as well.
Great, thank you. All right, well, thank you so much, Will and Christina, and for everyone that took the time to hear from us today. There's a quick evaluation at the end of this program, and we encourage you to fill it out and give us feedback and tell us what you want to hear in the future and how you want to be involved. Thank you so much. And we have actually another webinar coming up on Monday, November 16th. Go ahead, Will.
I just wanted to thank everybody and for your participation and today, but more broadly for being our partners and our supporters and our fellow travelers in the work of community in Greater New Haven. It's never been more needed than it is right now.